Hello, my name is Scott Busby. I'm an optometrist and just wanted to explain a little bit about what I do during the eye exam and show you some pictures of the back of
This
her
is
eye.
one part of the equipment that I use. This is called a phoropter. We put different lenses in front of the patient to check the vision. If I show you on the computer system here, I can click on there, which closes the eye. This opens it. So we can change all the lenses on here just by scrolling my mouse up and down. I can also control the letters on the chart, which is this here, and you can see towards the end of the room it presents itself up on the computer screen there. Different pieces of kit in the practice here. This is the microscope, so it's binocular, which shows you a 3D image of the back of the eye. We also have a camera and scanner of the back of the eye, which is something that I'll show you the pictures of in a moment. So this is a photograph of the back of the eye. This is a picture of Professor Rodriguez's eye that we took the other day during the eye test. This is the right eye. So if I click towards here, this is the optic nerve. The optic nerve is a signal that sends different messages back and forward to the brain. Essentially, the retina is an extension of the brain in the developmental phases when you're just an embryo, and therefore anything that happens at the retina usually affects the brain in some way, and therefore affects the vision in some way as well. So at the optic nerve here, it's nice and spherical, and there's a little yellowy part right in the middle there, which is what we call the cup, and that's where all the blood vessels go down into the back of the eye, and it sends a signal back to the brain. Now, different conditions can happen there. One of the most common ones is glaucoma, and that is usually increased pressure that causes damage at the optic nerve, and this cup in the middle becomes bigger and bigger, and the rim around it becomes thinner and thinner, and that affects your peripheral vision, and we do that check in practice as well. Obviously you can see there's lots of blood vessels, so we have the arteries and the veins here which take the blood back and from the eye, and we can tell from the blood vessels if someone has high blood pressure or diabetes, high cholesterol, amongst other vascular conditions. Also, you can see there's a darker patch in the middle here. This patch is called the macula. It's for your central vision, and this is a really important part of the back of the eye. When you look straight at something, that's where all the light focuses on the back of the eye. Therefore, it's very important to wear sunglasses because it protects this area from UV damage over the years. So you tend to find people that have lived abroad or that are out in the sunlight or go in sunbeds a lot without eye protection, you will find there will be changes in this area. If I click to the side here, we can bring up the left eye as well, and just shows you the comparison between the two. You'll notice that they both look fairly symmetrical. If I come across the left eye, the optic nerve is pretty much as round as the right eye is, a little bit more oval. The blood vessels as well are a little bit bendier, but that's still very normal. Everything looks nice and healthy there. So that's the both of the eyes there.
I hope you enjoyed that short explanation of what I do. There's obviously quite a lot of detail that goes into it. What I would suggest to anyone is to get their eyes tested regularly. There's many eye conditions and general health issues that can get picked up with an eye exam, and you don't always know that you have them. So even if you do not need glasses, I would still strongly recommend getting your eyes tested and going regularly. So if you get to know your own optometrist or eye doctor locally, you should be able to go and see them every couple of years, and if they have the technology to take pictures of the back of the eyes or scans of the back of the eyes, they can then compare that year on year and tell you if anything is changing or not. So I hope you enjoyed that brief summary of everything I do. Thank you.